Bridging the gap between affordability and convenience, Dispatch Health is revolutionizing healthcare, ensuring that essential medical services reach those who truly need them. With commitment to accessibility, they are setting a new standard for healthcare that puts patients first wherever they are. I'd like to take a second to introduce my team who are focused on helping Dispatch Health dispatch more health. Hi, my name is Thomas Wynn.
I'm Sophia Brewer.
I'm Olivia Van Zee.
I'm Jack Phillips.
I'm Paige Snyder.
And I'm Jeremy Nelson.
And here's a quick overview of our presentation and the core elements that we'll be advising on. We'll start off with the target market and move on to long-term growth. We'll then talk about the financial attractiveness and end with the aligned interest. But what is Dispatch doing? Dispatch is implementing a new service called Bridge Care and deciding on an insurance provider. With this in mind, we believe that Dispatch Health should collaborate with United and WellMed in order to maximize the amount of people who can benefit from the great services that Dispatch Health provides. United and WellMed cover populations that would be able to utilize their services more often compared to other insurance companies like Kaiser and Blue Shield, who don't provide any Medicare or Medicaid at all, which are the populations which are more likely to need Dispatch Health. I'll let Sophia go over the target market and how the insurance companies we selected align with the people we want to help.
First, we evaluated United Health, WellMed, and Kaiser's potential under Medicare compared to Dispatch Health's numbers. We found that under Medicare, 50% of Dispatch patients are older than 65 with an average patient age of 75. United's average age of their patients is 60 with services to over 13.7 million people under Medicare. Although United members' population does tend to be lower than all other companies, they are still compatible with Dispatch customer matrix. When comparing to WellMed, we saw the same trends. Under Medicare, WellMed's average age is 70 years old, which correlates with the industry average, and Dispatch's average age of 65 years or older. WellMed also serves 2 million people under Medicare. Kaiser, however, doesn't serve anyone under Medicare. When evaluating United, WellMed, and Kaiser under Medicaid, we found that 61% of Dispatch Health patients have social determinants, and United Health serves 8.1 million people under Medicaid. We also found that WellMed serves 2 million people under Medicaid and Kaiser doesn't serve anyone. Considering this, we also wanted to look at demographics. United's demographics serve people who take an average of 5 medications and have between 3 and 8 serious medical conditions. WellMed's demographics serve people who take an average of 10 medications and have 6 to 8 serious medical conditions. Both WellMed and United customers live in both safe and unsafe neighborhoods and have either some or no access to quality food and physical activities. Dispatch Health customers take an average of 15 medications, and each patient has 2 or more diseases. We also found that 61% of their patients have social determinants of health that help with housing, neighborhoods, foods, and physical activity access. The customer demographics that both WellMed and United possess correlate with Dispatch Health's target market. Because of this cohesiveness, it allows for new revenue from each company while still maintaining Dispatch Health's and overall interests. As we consider these demographic trends, I'll pass it to Liv to highlight the long-term growth strategies we need to succeed in the future.
Thank you, Sophia. Looking deeper into our 2 choices for Dispatch Health's health distributors, WellMed and United clearly show long-term growth potential. United Healthcare is positioned as a distributor with an extensive reach, both nationally and globally. United already serves customers in all 50 states, referred to as Optimum on the map. They maintain a significant global presence unmatched by other distributors. Partnering with United would allow Dispatch Health to expand across borders, tapping into an entirely new global client base. In terms of scope, United serves 13.7 million Medicare patients across 38 states and 8.1 million Medicaid patients in 32 states, with a total of 52 million clients worldwide. Through this partnership, Dispatch Health would gain access to a vast, diverse client base, exponentially increasing our reach and allowing us to serve more patients than would otherwise be possible. Another significant advantage is United's service across all 3 major insurance sectors: Medicare, Medicaid, and private insurance, something not offered by other competitors like Humana, Blue Shield, or Kaiser, which focus only on 2 or 3 of these areas. United's presence in every state ensures we reach the maximum number of potential clients, a critical factor for our growth trajectory. WellMed, on the other hand, brings a well-established localized presence, primarily in Florida and Texas. In these regions, WellMed serves over 1 million Medicare patients and 1 million Medicaid patients, making it a powerhouse with local clientele. By partnering with WellMed, Dispatch Health can expand its patient base significantly with these strong markets and shift our focus from strategic growth rather than survival. Through WellMed's solid foundation, Dispatch Health could benefit from upselling, cross-selling, and enhancing both revenue and long-term growth profitability. The financial stability offered by WellMed's client base creates a reliable foundation for scalable growth in these key regions. Both United and WellMed offer unique pathways to support Dispatch Health's growth, each with a distinct advantage in client reach, revenue potential, and strategic scalability. With this background, Jack will now present on the financial metrics for WellMed and United Health.
Who has the best contribution margin to Dispatch Health per visit? Well, it depends. For example, Kaiser or Blue Shield have the highest contribution margin per visit in terms of private healthcare, with 69 and 80% returns, while Humana and Intermountain Health are in the middle of the pack. So when just glancing at the numbers, it would seem Kaiser or Blue Shield would provide the most revenue for Dispatch. However, when you take into account the amount of potential sales, you get a different answer. But first, let's look at WellMed and United's contribution margin per visit. WellMed provides the best contribution margin per visit for both Medicare and Medicaid out of all 6 potential channel partners. However, its one shortcoming is its lack of private healthcare plan. And that's where United comes in. At first glance, they don't look too appealing. However, their private healthcare plan fills WellMed's shortcomings perfectly, and together the two provide full coverage across all 3 healthcare plans. Now, as we've mentioned before, Dispatch Health's current customer base, it mainly uses Medicare and Medicaid, allowing us to accurately predict that most of Dispatch's sales will come from one of these plans. Using the equation for total contribution margin, we could see that just 6 Medicaid visits using WellMed would lead to a higher total contribution margin than 1 private visit using Blue Shield. And we predict that that ratio will be even higher, meaning more revenue. So what? Dispatch isn't trying to make the most money. You're trying to provide the best services. Why do the financials matter? Well, in order for Dispatch to provide the best services and help the most people, you need to reinvest back into the business. That could mean expanding operations or hiring more experienced nurses and caregivers. We believe WellMed and United will give Dispatch that needed revenue and allow them to achieve such goals. With the numbers covered, here's Paige with the aligned business interests.
Thank you, Jack. Financials are important, but we also chose these 2 partners specifically with their alignment to Dispatch Health's interests. First and foremost, WellMed and United are great fits in regards to business interests. The other presented partner options like Kaiser or Blue Shield had attractive qualities, but we chose WellMed and United ultimately because they are the best. All 3 channels are interested in keeping their business in good standing with their patients, employees, and the community. In 2011, WellMed partnered with United, telling us that their values and goals align with the business presented. And in 2021, United became an equity shareholder of Dispatch Health. By association, we can see that all 3 partners align with one another's businesses through established connections. Mission statements are presented to communicate their values and purpose to the world, and all 3 healthcare channels have similar missions and social fit. Dispatch has a mission focused on delivering trusted, compassionate care in the comfort of home. WellMed emphasizes helping patients take control of their health for lifelong wellness. And similarly, United's mission is to improve health and better overall healthcare systems for everyone, patients and providers. All 3 channels find themselves centered around improving patient care and overall health care. Dispatch definitely focuses on more home-based care, but with the addition of either company, we will see a broader approach to their system. And finally, one of a business's most appealing qualities is their commitment to goals, and we found that WellMed and United have the same drive as Dispatch Health. The vision Dispatch presents is that they hope to build the nation's largest in-home healthcare system. In relation to WellMed and United, it can be said that all share a common goal of developing healthcare to meet the most diverse patient needs. Both WellMed and United desire to change the face and improve healthcare, making them deeply committed to Dispatch's goals, especially for those who require in-home healthcare. Now that we've explored all 4 categories, I'll hand it over to Jeremy to wrap it up.
Thank you, Paige. Wrapping up, I'll give an overview of Dispatch Health's mission and what our team has discovered. The Wall Street Journal article emphasized how people have lost trust in at-home care. Dispatch not only wants to change this, but they also want to make the healthcare system as a whole more affordable. Through partnering with WellMed and United, Dispatch will be able to add to their credibility and lower costs for patients. United Health and WellMed are the best options for a few reasons. The first is the target market. Both these providers serve almost the same demographics that Dispatch does. This is the first step in determining a provider. Second is the long-term growth potential. We believe this is the most promising opportunity. Being able to provide globally through United and expanding outside of Texas and Florida with WellMed will allow for the most cost-effective care that CEO Mark Prother dreamed of. Thirdly, touching more on financials, WellMed's contribution margins in terms of Medicaid and Medicare allow for lower costs, further reinvestment, and more profits. Despite United's poorer contribution margins, their ability to provide in the private sector is attractive. Finally, the aligned interests between Dispatch and the two providers show that they are committed to the same mission, bringing cheaper and more quality care to everyone. In his interview with Andy Lacey, Kevin Riddleberger said that 37% of ER patients don't require emergency care. With bridge care, they can treat this population, allowing for the sickest people to be in the ER. By partnering with WellMed and United, Dispatch will be able to bring their bridge care to patients' homes for a cheaper cost. They'll show further commitment to their patients and the healthcare system, and they'll give added value to existing shareholders while creating the chance to bring in more. Therefore, helping dispatch more health. Thank you.